just had an oral examination and a cleaning. Would you like to know the results?
Yeah.
So one thing that we've found was that your mouth is in overall good good condition. You did not have any caries. One thing that we did find was that there is a little bit of a pocket developing between your tooth and your gums in a couple of places. We also noticed that there was some redness and a little bit of bleeding in your gums. Have you noticed that?
Maybe a little bit, but I don't know.
Do your gums hurt often?
I guess when I occasionally floss,
Another thing we noticed is that there was some what we call plaque, a little bit of buildup. And are you aware of what plaque is?
No, can you tell me?
So what plaque is it's basically when there's some bacteria in your mouth and they congregate and grow, and this can be harmful to your gums and gum tissues. Can you tell me a little bit about how you clean your teeth?
I brush in the morning when I wake up and before I go to bed, and floss maybe once a week. I don't know. It just kind of when I feel like it, and that's it.
So, how do you feel about what your level of oral hygiene is, or where you're at right now?
I think it's pretty good.
Scale of 1 to 10.
Maybe an 8.
8. Okay. So, one of the things that we do is educate patients as to what their level of oral health is. One thing we want you to be aware of is that this recession and bleeding can lead, if it stays on the same course and continues, to what's called periodontitis. And so what that is, are you aware of what?
No.
Periodontitis is when plaque actually get deeper into the pocket and of the tooth and
Around my gum, or in my gum.
right between the tooth and your gums, and actually start to cause the gums to separate from the tooth. And if the pocket gets deep enough, there can be bone loss and mobility of the tooth eventually.
That doesn't sound good.
So, are keeping your teeth important to you?
Yeah.
So.
I don't want dentures.
Right. Can you tell me one way that you think you could improve your oral health care habits?
Maybe eating less sugar. I have a sweet tooth.
That's definitely one way. And what type of sugars are you eating?
I have pop a few times a day. I like desserts.
So do you think that you'd be willing to reduce the amount of sugars that you take in during the day?
I guess I didn't know there was such consequences with it, so thinking about that more, it might impact, we'll see, but I think it's a definite possibility.
Okay. And what would you be most willing to give up?
Maybe switching some of the pops I drink to water, or I don't know, what's a better option?
Another option would be to maybe drink out of a straw, or drink less frequently. Drink with meals. That's another thing. If you can drink your soda maybe with a meal, don't eat a snack in between meals.
Okay. I have to try some of those.
So back to your oral health care habits. knowing what some of the long-term consequences are, do you think there's any ways that you can improve your oral self-care habits?
Like flossing more?
Cleaning in between your teeth is definitely something that we want to work towards. Is that something that you can commit to?
I think I can now that I know the consequences that I didn't know before.
Mm-hmm. How many days a week do you think you can realistically?
3.
I think that's a good improvement. I think that's something we should work towards. Okay, well, so we'll keep a watch on your gums and make sure that you're here in your next checkup, which is in 6 months.
Okay.
Okay, good. Excellent. Thank you for your time.